Hi again, this is Dr. Marina Mangano going over the healing insight and the intentions of Chapter 2 of The Gift of Healing Hands. So as I'm reading these chapters, I'm marking the main points that I really want to dissect and discuss a little bit more in depth. But then overall just give you a general idea of what this topic is about, what this chapter is about. And so after our foundation chapter of chiropractic in Chapter 1, it's starting to really get into more of my interest. So obviously I'm interested in chiropractic. It's what enabled all of these higher level techniques. But where I started to veer away from the pack really begins in this Chapter 2. So I had, specific upbringing in something called emotional pain. It's starting to make a little bit more highlighted points in the medical field, but it's something it's kind of taboo to say, oh, I think this is something you're stressing with, you're dealing with an emotional issue that's coming out of the body physically. And so the scientific word for that is called psychosomatic, meaning psycho to the soma as Latin for the body. So something from the psyche is resonating and coming to the surface in a physical symptom, a physical ailment. So the term psychosomatic is starting to become some part of a normal dialect in a lot of lectures and seminars, even within the patients that are finding me in my office. When I say psychosomatic, they're like, oh yeah, I know what that is. And of course, I'm seeing a small sample size of people who already utilize alternative healthcare and chiropractic and some of these lesser known, separated from Western. So it's hard to say that everybody knows what psychosomatic is. But in this chapter, I start to go through the levels, the stages that I introduce this concept that your body is an accumulation of experiences, an accumulation of stored emotions that as you're cellularly developing, your body doesn't just add on new cells, it remembers what you were experiencing, what you're feeling at that time in your life. So I describe it as like the rings of a tree. Every year as the tree expands outward in these rings, if you unfortunately cut the tree and then look at the top of the lifespan of this tree, you can see years that the tree has surpassed, that maybe nutrient density was limited, maybe there was a forest fire, something in this tree. You can see the health of the building blocks of this tree. And so whereas we don't have maybe such a cut and dry example of that, as you start to get into some type of manual work, so someone's putting their hands into your body, manipulating the tissue, stroking the tissue, making these things come to the surface, we start to see some really interesting stuff happen on the table. So if you've ever been to a massage therapist and just started to hit this tolerance of pain, makes you nauseous a little bit, you sweat a little bit, and then you have this, I surpassed it moment, and then this flush. We call it an emotional release, and that can happen from physical stimulation, like in chiropractic after an adjustment, in conjunction with how quickly the nervous system is spiked. Some people have that after a yoga pose, that they had to sit there in an uncomfortable breathing posture. And I can see in class when they're getting there, they want to either back out of the pose, or if they stay and embrace it and head face on, they have what I call an emotional release. And so anybody who works with physical touching of bodies knows that there's this experience within us. It happens at different levels, different stages. Some people are verbally stimulated to have emotional releases, or visually. They see something and it just really touches them, helps them instantaneously heal some blockade in their body. And so they look at me like, what just happened? What did you just do? And through developing my message and trying to explain them, that's what the second chapter is about. So where emotions come from in our actual brain, how then they are communicated through different synapses of the body, where along the spinal cord they are located, how the body communicates back and forth out from the brain, back to the brain, and tying motor patterns of movement with an emotional pattern. So you don't just learn, oh, I'm going to bend forward. You learn how you think it feels when you bend forward, or the reward of what you're going to get once you bend forward, or the fear of what's going to happen once you bend forward. So with movement comes an emotion, comes an expectation. And that's where, when you get into an opportunity that a provider has the time, has the scope of practice, has the passion to address both components of that motor pattern, that emotional pattern, is where I think true physical healing lies. And if that's a great doorway to then spiritual healing, mental healing, absolutely. But usually that's where I meet people, is when they need physical help. And then we go through these tiers, we go through these chapters. So in a very brief term, not to give away the whole chapter because I want you to read it, going through just the stages. So I explained psychosomatic pain is that this is not real. This is in your head. As I don't believe that what we experience, there's so many layers and priorities of pain and sensation in our body that your brain is only allowing you to focus on the first most important issue. Then once that is addressed, then it brings other things to the surface. You'd be overwhelmed if your brain let every sense come to you at once, come to our conscious mind at once. So I do think psychosomatic pain is very important to understand, but I never think that it's only one thing. Is it the chicken or the egg? What came first? Do you have psychosomatic mental imbalances? Do you have a mental perception that's limiting your physicality? And then as your physicality is imbalanced, natural structure, natural forces are placed with an uneven load of pressure, like we describe in chapter 1. And then you have cellular inflammation. Then you have uneven damage to tendons and ligaments. So I think both need to be addressed. Absolutely. And some people, I have to address the physical before we could get to the mental. Some people come in and they're like, please help me with this mental, and then we can get to the physical. So it's really case by case. But then I even go a little bit past psychosomatic pain, and I get into more a category that I introduce as metaphysical pain. And this is where I have to be careful as a chiropractor, because that is not something that we can recreate. There's no research to prove, to guide us. There's no insurance-based safe markers of this type of interaction that I'm describing. And so I really utilized writing this book as a way to hone my message and to question what is my purpose as a doctor. If I am keeping people safe, if I am staying within the limitations of my scope of practice, is my job to regurgitate research, to regurgitate statistics, or is it to give people a sense of hope and help them to understand their body? And so that was a very big turning point in my career, and a lot of mentors helped me get there. A lot of even some of the chiropractic students that were working with me into this weird direction. If I was flying out there by myself, I don't know if I would have made some of these steps, but having the people around me that I really respected, that were very successful clinicians, also asking some of these questions, also being honest about some of the realizations they were seeing in their practice, gave you that strength to fully take the turn, because once you accept that there are things happening in the body that are not muscles, bones, nerves, then you have to embrace, what do I do with this? And so I think there's a lot of practitioners, not just chiropractors, but massage therapists, medical physicians, that accept and completely acknowledge that psychosomatic pain is a thing. Maybe some type of mentality pain, like this metaphysical pain I'm describing, above physical, metaphysical, so something beyond the structure. But if they believe it, if they preach it, they have to be able to fix it. So without the right training, without the right group of mentors and that support system, that's where a lot of physicians and a lot of practitioners stop, because they don't know how to find patterns that they can explain to their patients. They don't know the resources to, when patients are exposed to this and they have this epiphany that there's something living within in them that they can communicate with, that they can alter, that they're on the same team, then they want your time. Then they are like, oh my gosh, please give me all these skills that you have. And so without the proper group of support to help keep you sane, and without a quick list of, I know the kind of person you are, I really think you would like this book, you can kind of divert that attention-seeking patient to just the next step of their journey. So I'm super happy to break that barrier in my office, expose people to this knowledge that is already within them, but then it's not my place to be their only teacher. It's not my place to push them to a level that I need them to be at. Sometimes life just needs to happen before they're ready to take the next step. So when I'm working with this population, I love sending people out to other providers. I love I'm an avid reader, and that's why, over the years, I think my book is an accumulation of hundreds of other books and other really brilliant writers. But if I didn't have that exposure to all those books, I wouldn't have such an easy way to send people on the direction for further learning and continuing education. So with metaphysical pain, I also break it down into one other category: metaphorical pain. And some of the most famous people in this realm of intuitive healing that believe in metaphoric pain, Louise Hay, the founder of the Hay House publishing company that my book, Balboa Press, is an offshoot of. Louise Hay has some wonderful books, You Can Heal Your Life and things like that. I think it's on my shelf here to pull it up. Heal Your Body. The discussion in her field, she does not have a license. She does not have a medical obligation to hold back from making claims that can't be guaranteed or that could make claims outside of your scope. So she can go rogue. She can just be inspiring, and she can express her own experiences of how she healed her body and how others along her conferences and workshops have done so. So in my practice, because I am still a practicing clinician every day, I have to be cautious with saying, hey, I can sense what's going on in your marriage when I'm working on you, and I really think you need to do this. That's not my job. My job is to help you become structurally, functionally sound, very balanced through your spine, give your core the opportunity to keep your extremities safe and moving. And as I'm doing all those things, we're human. We're going to have a conversation about what's going on in your life. I'm going to relate to you on certain stories, and then I'm going to, in the back of my mind, be taking notes of, this is a clinical red flag that I need you to go see a therapist. But the metaphoric pain is something that I started to, it's just like this nagging voice in the side of your head when someone's talking to you and you're like, I don't want to get away from this. I got 20 minutes to help this person today. They expect me to rub their muscles and crack their bones, which is not what chiropractors do, but that's what usually people say. But I really just feel like I need to ask her, what does freedom mean to her? And so as soon as you start to listen to that little nagging voice in your head, you know that you are becoming an intuitive clinician. Just those little subtle notes of there's something bigger going on here really opens the doors to beautiful conversations, very physical realizations, and just these barriers, these melting, shedding barriers that come away. So, that was a long way of describing metaphoric pain. Is the simple, someone comes in with this really stabbing pain in their thoracic spine, and I could adjust their rib head, I could work through their core, I could cup them, I could scrape them, and it's just nothing's changing. And so I could waste so many visits doing that. Or I could realize, wait, when did this start? After a huge fight with your cousin that you feel betrayed by? Okay. As I'm working on those normal things, let's have a conversation about being stabbed in the back. So metaphoric pain is underneath that metaphysical pain in my mind of these metaphors. Our very symbolic, very visual brain creates a story, and then the more that you reinforce that story in your life, you see little opportunities to reinforce your reality with that story in mind. I believe your physical body then starts to show that metaphor. So I give a whole list and a couple of really cool stories in the book that go into a little more detail about some of the, the first times that I noticed this happening, the conversations that leads to, and how quickly these metaphors can be solved, rewritten, and almost laughed at. But once people can see the quick change in their pain, the quick change in their function after having a conversation, after verbally rewriting some of these, non-tangible things, they leave thinking like, oh my gosh, what else can I do? What else is this amazing body capable of? So it's been really beautiful and a little nerve-wracking at times direction that my career has taken. And I was so happy to be able to really sit and express that in this chapter. So let me make sure I hit my points here, but those levels of classifications of pain are in this chapter. So chiropractic is usually a mechanical type patient. They need movement in their structure. They need rewiring of their neurology. That's all a mechanical, anatomic clientele. Some people come in and that area, while can always improve and can always help the systemic part of your body, some people are not a chiropractic candidate. They need to go see a functional medicine doctor. They have an internal medicine issue. They're more of a chemical classification of patients. So chemically something is irregular or awry in their system that may be affecting why they came to me, affecting that structural side. Like I said, I don't think everybody ever lands in one of these categories. There's always a combination, but it's up to the clinician and the experience of how many hands, how many people we put our hands on to catch those patterns faster to get you to where you need to be as soon as possible. So we've got mechanical, we've got chemical classification, and then I work into this kind of way out of left field type of metaphysical pain. And so again, there's always a combination on the spectrum, but most clinicians dwell in this one little chunk instead of opening up to even the more functional category of assessing people's systemic needs. And then as you really dive into and opening your, taking the blinders off of the horse, opening your perception to, yes, there is this mentality affecting all the other things, or these other things are a repercussion of the dis-ease and the lack of balance, the lack of symmetry in your mentality, in your perception, in your reality. So really great stories in here, and I'm just really looking forward to just going through. I'm already so much more excited to talk about this chapter than I was with the chiropractic story. But you have to honor every part of your journey, right? And so this is where things really start to pick up steam, and I hope you like it. Please let me know if you have any questions, and I look forward to our discussion of chapter 3. Have a great day.